I'm Molly Hadfield, the Media Relations Director with the City of Topeka, and also a Public Information Officer for the Topeka and Shawnee County COVID response team. Commissioner Bill Rippon, Mayor Michelle De La Isla, and first I'd like to have President and CEO of Stormont Vale Health, Dr. Robert
The EMS crew that transported the patient from Yates Center followed all precautions, and we believe that all the people involved in the care of this patient, from transportation into the hospital and subsequent hospital care, have all followed the appropriate CDC guidelines and have worn all of the protective gear that have been recommended. We have prepared diligently for this day, for this patient, and we are continuing to prepare and are ready for what surely will be more patients, and surely that will come very soon, we believe. This patient will have no impact on our ongoing operations. We remain open and ready to care for all of the residents of Shawnee County and the surrounding region. I want to commend our staff, our employees, our team, and all of the community for everything that we've done to prepare for this time. It remains of utmost importance to follow the recommendations of our county and local leaders around staying home. If you're sick, stay home. If you're sick, call before you try to access care. Follow the guidelines with regard to washing your hands. Don't touch your face. All of the things that we know can help mitigate the spread of this virus and the spread of the disease that it causes. So that is our opportunity to mitigate the impact to our community. And again, I'd just like to take this opportunity to commend all of the local leaders, and particularly our county and local leaders, with the guidance that they've given, and look forward to continuing to support them and support our community through this crisis. Thank you.
And if you could please hold your questions till the end. Next up, I'd like Dr. Pizzino to provide some updates.
Good afternoon. Gianfranco Pizzino, Shawnee County Health Officer. Thank you, Dr. Koenig, for the information, and thanks to you and your staff, as well as the staff of St. Francis, the other hospital in town, for the incredible work that you are doing under these circumstances. This community is really lucky to have such good healthcare facilities. For those of you who are not aware of that, Shawnee County ranked last year #5 for clinical care in the state. That's quite an honor, and it's really thanks to the work that Dr. Koenig and his staff and the staff of St. Francis have been doing day in and day out. The main reason I'm here today is to let you know that this afternoon I signed an order that is called the Safe at Home Order, which requires that everyone stay safely in their home. What does it mean? It means that everyone should stay home except for essential needs, such as getting food, caring for a relative or friend, getting necessary health care, or going to an essential job. And people who fall into vulnerable categories should always stay home. It is okay to go out for walks if you're not in a group, if you are alone. But otherwise, there is a lot of restrictions from this point on in the kind of movement that people can do, are allowed to do in this county. So let me tell you why we are doing that, and then I will give you a little bit more details about how this is going to work. The reasons for which we are doing that are the number one, the infection is spreading. Even though we do not have a detected case yet in Shawnee County, there have been several detected cases in multiple counties around us. You probably know that the Kansas City metro area has already implemented, effective today as a matter of fact, an order very similar to the one that is going to go into effect on at 12:01 on Thursday morning in Shawnee County. So 12:01 on Thursday morning in Shawnee County. And really Johnson County, Wyandotte County, and the Kansas City metro area have been hit really hard. It almost looks to me, and this is totally non-scientific, but if you look at the trends in the map, it almost looks like this virus is spreading to some extent west to east. I'm sorry, east to west in Kansas. So it started really hard in the Kansas City area, then Douglas County was hit. They finally confirmed their 5th case, which was the first community-based, I believe, case. So the previous case had all recognized the risk factors. And then there are sporadic cases in communities around us. As I said before, I do not believe that Shawnee County is immune to this virus. I strongly suspect that this virus may already be in our community. We just have not been able to find it because of limited testing. And that is another reason why I decided to go ahead with this order. Our testing situation remains pretty critical. The Kansas Department of Health and Environment received a few supplies that will enable their staff to keep working on their testing, but the supplies are nowhere even near where they should be right now. And for the reasons, they were forced to implement pretty strict criteria for who they can test and who they cannot. Private labs are coming online faster and faster on a daily basis, and now we have several important reference labs nationwide that are offering those tests. However, it's still require agreements between healthcare institutions like Simon Weil and St. Francis, or individual providers and those labs for those tests to be accepted and processed. In addition, they also have a backlog of tests. So I was told that the average return time from private labs right now can be as long as 7 days. I said that the number of cases is going up. Remember, we talked about exponential growth, I believe, last time. And what it means is that the number of cases will double every few days. That's what we are seeing nationwide. Number of cases is doubling every few days, and I think Kansas is heading in that direction. Of course, our cases are nowhere near as the rest of the country, where the rest of the country is, but they're starting to accelerate. So the rate of growth, the amount of cases that we have, is starting to accelerate day after day. So I wouldn't be surprised if Kansas is also heading to an exponential growth of cases, which again makes it harder for a community like us to think that we are going to be immune for much longer. We also have a growing number of individuals being monitored in our community. On Monday last week, we had 53. Today, we have 155. Like many of these are individuals with a recognized risk factor, such as traveling. Some of them have been identified as close contacts to cases that occurred in neighboring counties. So again, it speaks to the importance of having a coordinated approach in the region so that we can all try to contain the spread of infection the same way. But the presence of such a high number of individuals at risk who are being monitored, and the fact that this number is going up, makes me think that the risk of an infection in Shawnee County is growing even higher. If you put together, once again, the incubation period of the disease, that can be up to 14 days, the limited access to testing, And the fact that there is a delay in testing results to be available, that can be as long as 7 days, you easily come up with a 10 to 15 days lag time from the time somebody becomes infectious to the time we can detect that infection and confirm that infection. That is way too long. The final element that convinced me that it was time to do this is the overwhelming support for this decision that we have received from our community leaders and from the public. We have been meeting in close meetings with representatives from small business, large businesses, our schools, our public officials, everybody expressed their support. Everybody listened carefully. Everybody pointed out how painful some of these measures are, and everybody said, if that's what it takes, we are on board. A lot of support from the medical community, and frankly, a lot of support from the community. I just got this postcard just a few minutes ago. It just a thank you note from a member of the community. Say thank you for all that you're doing to keep us safe. And we cannot let them down, as painful as this is going to be. So these are the reasons why we are doing that. In practical terms, I'm sure there will be a lot of questions unanswered. We can only address a few of them at a very high level today. This ordinance will not go into effect until 12:01 a.m. on Thursday, so people will have the rest of the day today and all day tomorrow to get ready and do whatever they need to do. And tomorrow at 6 o'clock, we will have a live Facebook chat where we will try to answer as many questions as we can during about an hour period. At the same time, we are developing an FAQ document that contains a lot of the most common questions that people may have. So hopefully the document will certainly be available before the Facebook session tomorrow. Hopefully people will be able to consult it and get the answers that they need. But for today, at the very high level, what is it that people cannot do? You cannot engage in group activities, either in person, in group activities in person with other people. So virtual group activities, of course, are okay. You cannot be in person with groups, with any other people. You cannot have dinner parties. You cannot have birthday parties. You cannot invite friends over to your home just to hang out. You cannot go to bars and nightclubs. Of course, we already know that. Unless it is to pick up food that you have ordered, or you can call them to have the food delivered to your house. You cannot go to a nail salon or get your hair cut by a stylist or a barber. Those places are not going to be able to run their business under this ordinance. You cannot go shopping for non-essential goods. You cannot take unnecessary trips on public transportation or in your car or on your motorcycle. Unnecessary trips. So what is necessary and what can you do and what will still be open? All essential services will still be open, and the ordinance contains a long list and examples of services that are still allowed to be open and continue their business. Public transportation will continue, gas stations, pharmacies, food venues, food establishments, with the exception, of course, of restaurants and bars, grocery store, farmers markets, food banks, convenience stores, takeout and delivery restaurants are still open for food and essential items. Hardware stores, plumbers, electricians, those who provide services necessary to maintain our safety, sanitation, and essential operation in our residences. Banks, auto repair shops, community benefit organizations on a case-by-case basis if they provide a service to the public that's deemed to be essential. Laundry services, laundromat, cemeteries. This list is long, and I want to make clear, this list may change. We purposely try to minimize not to eliminate, because it wasn't possible, but to minimize the impact and the burden on our community of these measures. So we decided to start with a fairly long list. Whether the long list remains in place or not depends on two things. Number one, what we observe in terms of spread of the disease in our community, if you're going to have more cases or community-based transmission and how bad that is. And number two, the level of cooperation and compliance from the public. If we start seeing people hanging out in the park in groups, just, taking walks downtown just for the heck of it, just disregarding, essentially, the spirit of this ordinance, which is you've got to stay home and away from other people. If we start seeing people doing that, then we may need to take more strict action and try to stop those situations and make the ordinance even more strict. The last thing I want to address is how long this will last. The current ordinance has a duration of 30 days. I've always been very honest and very frank with our community and with all of you, and I'm going to do the same today. We are not going to get rid of this virus in 30 days. What I hope that we can do in the next 30 days is to slow down the spread and the speed of spread of this virus to a point that will allow two things. Number one, our healthcare providers to be able to provide healthcare in a safe environment for both the providers and the patients, so that the healthcare system is not going to be overwhelmed. And number two, our public health system to respond to the outbreak in a way that is manageable, so that they can identify cases and identify the close contacts of those cases. I hope that in the next 30 days the testing situation will improve. At the end of the 30 days, we will reassess the situation and decide what needs to be done. I can't promise anybody that this will only last 30 days, but I can promise you that this will last just for the shortest possible period that is bearable for our community as a whole, and that can allow for this infection to be under control and not to result in hundreds of deaths in our community. I think I'm going to stop here for now, and when time comes for questions and answers, I'll be happy to address those.
Next.
Good afternoon. I want to ensure that all of you know that this process has been a very difficult, long thought process. And I want to thank publicly Dr. Pezzino for his boldness and his courageous decision. It's a decision that we do not take lightly at all, and that we're doing so that we can ensure that our community remains safe, and most importantly, that as our hospitals are providing needs to our community, they are not overwhelmed. Through this process, we have been working closely with the governor's office and the state, and we are very appreciative of the guidance that we have received from them. Through this process, we have been working, as you can imagine, city and county together. I want to acknowledge that in the room, you may not see them here with us in the front, but you have City Manager Brent Trout. You have Commissioner Rippon, who is also in the room. You also have Matt Pavarnik. And I think that if given the opportunity, several of the individuals that we were talking to, trying to feel where their heart was at, I can tell you that the council is very much in favor of this measure. I can tell you that the commission is very much in favor of this measure. When I spoke with the schools, both all three, Washburn, Topeka 501, Shawnee Heights, Seaman, all of our schools, they were all waiting for this to occur. We didn't give them any indication because we were trying to figure out when we were going to get the order that this was going to happen. But everybody that we have reached out into our community has been in agreement that this is the right time. We've had some pretty much sleepless days, so I want to personally thank Dusty Nichols, Aaron Mahan, and Esther from Emergency Management, our PIOs, Molly and Gretchen, and all of the group that shows up, Matt as well, and all of you who have come to these meetings. Linda, you've been wonderful to work with. I want to tell you that I wish that you could see the battery of people that is working on your behalf, Shawnee County. I wish that you could see how all of us are collaborating to ensure that this is the best outcome in the end. I hope that the best thing that we can say is that Shawnee County was an example on how we mitigated the challenges and the risks early, and therefore our economic bounce back and our community bounce back was one that people are going to look into because we have been acting so early. Again, we don't take this lightly. As your mayor, I'm gonna ask you for a significant favor. I know that you're hearing this news today, which means that most of you will be able to stay home. Please understand that the same way that you're home, we're telling you that we are not closing the grocery store. We're telling you that we are not closing the gas stations. We're telling you that all of these resources will keep coming to you as long as you are judicious when you purchase. Please don't strain our supply chain. Please don't strain our supply chain. It is imperative that today and in the days to come, you realize that we are working extremely hard to ensure that all of your basic needs are being met. It's important to us. We spent till, I think it was almost midnight last night, looking at every possible item that we could ensure that was still open for your comfort. So please, please be respectful of the fact that there's some people that are gonna hear this and they're gonna wanna get something because they don't wanna be out on the street. Please, please, please don't take more resources than what you need. Trying to make sure, wanted to also address one big thing. I know that our schools, both Washburn and our public school systems, are talking to their students with regards to how they're going to continue education virtually. I made this ask already once, but I can tell you that at least only in Topeka Public Schools, we have close to 8,000 students that are having a digital divide. And if at these moments of time and trial, we have any individuals that can help us with donations so that we could get hotspots for our students, the Topeka Public School System came up with this awesome idea that they're sending a bus with a big router and they're placing these buses in neighborhoods so that our kids then that typically don't have access to internet are able to have free Wi-Fi. I think that we need 3 more of those buses. So if you're out there and you're listening and your heart is moved to figure out how to help, please contact Dr. Anderson, contact the Topeka Public School Foundation. That's gonna be a critical piece to ensure that not only Dr. Anderson's students, but any other student in our community that needs to have access right now more than ever has that sort of access. It's important. Our kids that need it the most are the ones that are not having that internet access. I wanna talk about the rescue mission. We are working closely with a community partner to try to figure out a way to ensure that the residents of the rescue mission and our guests that come to the rescue mission have a way to be independently housed. As more of that information comes, we will provide more information, but we understand in your community that having 2 hospitals that are regional hospitals, we must ensure that our most vulnerable populations are taken care of so that if we have the spread of the virus, it doesn't really impact a group that's already vulnerable. And the last thing that I will say in English before we transition into Spanish is that I know that our community has such a beautiful heart. I am inspired every single day by all of you. It's often said that when somebody is really stressed out, you really see what they're made of. In Shawnee County, Topeka, you are made of gold. The constant calls of telling us that you could make homemade masks, that you want to make homemade PPE. I want to tell all of you, please, right now, we're not able to take that. We're wanting to ensure that at this point in time, we're using all of the equipment that we have available to us. And at this point, there hasn't been proof that the homemade equipment meets the guidelines. So while we're in this period of trying to figure out where we're at with things, that's not saying that later on we won't come back to you, but right now, we've been so overwhelmed by your goodness. And we're trying to tell you that at this point in time, that is not something that we'll be able to accept. I promise you that when we do need you guys to come through for us, we will call on you. And we will absolutely say, we need your help, please help us out. So now I'll transition into Spanish. Queremos notificarles a todos que hemos emitido una orden de que estamos más protegidos en casa. Esta orden quiere decir que de hoy, del jueves a las 12:01 de la mañana, el requerimiento va a ser de que todos nos mantengamos en nuestro hogar. Si usted es personal crítico, de que su trabajo le va a dejar saber si usted lo es, como los policías, como gente que trabaja en el supermercado, personas que trabajan en restaurantes, doctores. Nosotros les vamos a dejar saber a través de su trabajo si usted es personal crítico, y si no, puede trabajar desde casa. Es importante que usted sepa por qué hemos hecho esto, y es que realizamos que el virus está pasándose de comunidad en comunidad. Si usted ve un mapa de los Estados Unidos, usted puede ver como del este de los Estados Unidos sigue creciendo la cantidad de virus que existe en el mapa, y usted ve cómo empieza a tocarnos en Kansas City y cómo se está empezando a regar hacia el oeste. Esto, y además de eso, el entendimiento de que no tenemos los exámenes de hacer la prueba, ha sido una cosa sumamente importante en llevarnos a tomar esa determinación. Es una determinación que no tomamos ligeramente, es una determinación que tomamos muy medida. Nos comunicamos con los negocios, nos comunicamos con las escuelas, nos comunicamos con muchos, con el Consejo de la Ciudad, con los comisionados del condado. Nos hemos comunicado con doctores, con todo el mundo, para asegurarnos que esta es la medida eficiente que debemos tomar. Así que por 30 días, empezando el jueves a las 12:01 de la mañana, vamos a estar todos en casa, a menos que no sea personal eficiente, que sea necesario, que sea crítico. No pueden usar el autobús, el metro, a menos que no sea para comprar comida o para ir al médico. No puede usar su auto a menos que no sea para una de esas necesidades críticas. Nosotros, a pesar de que en Shawnee County no tenemos un caso, no somos inmunes. El doctor Kennedy hoy informó que Stormont Vail, como hospital, tiene su primer caso en el hospital de otro condado. Y nosotros sabemos que estamos trabajando con equipo limitado de hacer el testing, y sabemos que probablemente en Shawnee County tenemos casos, y por eso es que estamos tomando esta medida. Queremos darle las gracias al Estado, a la gobernadora Kelly y a su equipo, que ha sido muy bueno trabajando con nosotros en asegurarnos que mientras hagamos estas medidas estemos uno al lado del otro, asegurándonos que estamos protegiéndonos y que la comunicación está abierta. Estamos trabajando para asegurarnos que las personas que están quedándose en la misión tengan oportunidad de tener un lugar separado para que no se contagien entre ellos mismos. Y también estamos trabajando para que sus hijos, que quizás no tienen acceso al internet, en un momento en que la semana que viene los estudiantes van a empezar a tener clases a medio de la computadora, estamos buscando alternativas para que sus hijos, si ustedes no tienen acceso al internet, puedan tener acceso. Le estamos pidiendo, por favor, que no compre más de lo que necesite. En este momento no estamos cerrando los supermercados, no los vamos a cerrar. No vamos a parar la gasolina. Es importante que entiendan que todo esto que es esencial va a seguir abierto. Si usted va y compra demasiado, lo que va a pasar es que va a ponerle estrés innecesario a esos recursos que todos tenemos que utilizar. Y finalmente les quiero dejar saber que no vamos a aceptar mascarillas hechas en casa y los trajes hechos en casa, porque no tenemos evidencia de que llevan a cabo el estándar de limpieza que le hace falta a los hospitales en estos momentos. De cambiar nuestra forma de pensar o tener una necesidad más grande, vamos a llamarlos y dejarles saber que nos hace falta. Pendiente ahora mismo tenemos 17 casos, 206 negativos y 155 en observación. Y eso es una de las cosas más importantes. Si recuerdan, hace unos cuantos días teníamos solamente 53. Hoy tenemos 155. Es una cosa seria. Les pedimos su cooperación. El doctor Pesino va a estar live en Facebook mañana a las 6 de la tarde. Yo voy a estar allí con él para cualquier cosa en español se aparece. Estamos allí para responder a sus preguntas. Por favor, tomen esto en serio. Si vemos que hay grupos juntos que no están respetando la orden, vamos a tener que tomar acción y no queremos hacer eso. La orden quiere decir que no puede tener mucha gente en su casa, no pueden hacer cumpleaños, no pueden hacer visitas con sus amigos. Es importante que se mantengan a su hogar y a su trabajo, si es un trabajo crítico, o a ir a hacer compra o a ir al médico. Así que eso es todo lo que tenemos por ahora, y ahora se lo paso nuevamente a Molly para que vayamos a las preguntas.
I just wanted to reiterate 30 days. And before we get to questions, I have a statement from the University of Kansas Health System, St. Francis campus. They have a multidisciplinary physician-led team working on COVID-19 preparation 24/7. We are preparing, drilling, and making changes to increase our inpatient capacity to care for COVID-19 patients. Is there any questions?
Overall?
Yes, overall, you all are free to ask questions.
Yeah, how will this safer at home order be enforced? I know you mentioned maybe stricter measures will have to take place if, people aren't following it, but how is it going to be enforced starting Thursday?
We have already communicated with our law enforcement agencies, both the sheriff department and the police department. They are ready to conduct enforcement as needed, both if their officers observe something that is not in compliance with the ordinance, and as a result of maybe people reporting something, or the health officer reporting a situation that needs to be taken care of. Having said that, let me be really clear. We are not here to start a police state. This is not, how do I say that? We are here to ask the public to comply because it's the right thing to do. We are not under siege. We are not at war. We are at war against the virus. There is no curfew. There is just an order whose spirit is stay away from each other.